So I'm Vicky Lewis and I'm the Executive Director for Data, Digital and Technology, the Chief Digital Officer for Worcestershire Acute Hospitals. We have a technology services partner who supports our first, second and third line requirements, and that's Computacenter. One of the first things that we did is that we did a baseline in terms of where are we and what does our status feel and look like, and also talking to clinicians and other key stakeholders about where we needed to focus in the first what would have been a normal 6 months. And then, as we know, in March 20, the COVID wave 1 pandemic arrived with us. That clearly threw those priorities up in the air. So we had to think about remote working for our staff. We had to think about remote monitoring for our patients. We provided iPads out into all of our inpatient wards so that people could remain in contact with their relatives because we weren't allowing visitors to come in. So some just real simple practical things. One of the key factors of coming into post as the Director of Digital for the organisation was within the first 12 months of my tenure, the technology services contract was due to end. Timing's everything, and certainly within the first 8 weeks it was really obvious that the COVID pandemic and how we needed to respond to that was going to be all consuming for a number of months, and that needed to be given real focus and priority. So during that kind of first 8 to 12 weeks, I took a decision that actually we would continue with our technology services partner and we would look to negotiate and have a new contract with them to ensure business continuity, ensure that we had certainty of service. So we moved into a new contract with Computacenter in April 2021, and we've done a huge amount of transition, and we've also implemented lots of new digital tools and new digital features, which has brought about a different feel for the end user. So for every clinician, every person that works within our organisation, they now have more up-to-date tools to allow them to operate in a digital world. So one of the real key pieces of feedback that I got when I came into post was that my staff, so the 6,600 staff that we've got within our organisation, felt that it was really difficult to get any access to help. So we've adopted a number of digital tools, and one of the real key aspects of that is the next generation service desk, which has gone down an absolute storm. And I think what we've seen and what we've been surprised at, or maybe not surprised, is the level of demand for digital. So we've got a next generation service desk in place now, which offers different digital functionality. We've got tech bars so people can drop in and speak to a technician, so you can book into a slot or you can just turn up and have a slot and a technician will try and help you or assist you, and that just makes it feel much more of a human presence for our teams, and they've, as I've said, been completely successful. So when we sought the investment for the move to NGSD, so Next Generation Service Desk, the business case was predicated on a channel shift, so away from that traditional phoning somebody up and trying to talk to them, and we needed to adopt and adapt to those new channels. That's been hugely successful for us, and some of the feedback's been great, but in terms of actual stats, we've actually seen a 50% shift towards the new digital channel away from a traditional telephone answering model. That's been fantastic. One of the things we really need to work on now is intelligent voice recognition and embedding and cascading those tools across the organisation, and we know that's kind of the next part of our journey, and we're currently working with Computacenter to enable us to do that. The feedback at this moment in time is really positive from the majority of the staff, particularly Tech Bar, which has like a 95% upwards customer satisfaction rate, which makes me feel lovely and warm inside because it means that we're actually giving something to our clinicians and our teams that they need. They are our strategic partners. They work alongside us on a day-by-day, minute-by-minute basis. Over the next couple of years, we will continue to develop and mature that relationship. It's fair to say that we've worked alongside each other, and the understanding about working in an acute hospital now is more embedded within the Computacenter psyche than it had previously been. So one of the really important parts of my portfolio is making sure that as an organisation we represent ourselves well within that wider digital agenda at the integrated care system level, and I'm currently the senior responsible owner for the innovation hub. So my expectation around working with my strategic partners is that becomes an enduring relationship. that we understand each other, we understand how things ebb and flow over time, and we also understand each other's key priorities and how we continue to work together and always maintain a professional relationship with each other. We're an anchor institution in the integrated care system. We're the biggest stakeholder as the Acute Trust, and therefore our strategic partners, so Computacenter working alongside us, are integral to the success of the ICS, because the more and more we will bring closer alignment between organisations, so patients flow across all organisations, don't we? We serve patients wherever they turn up and wherever they receive their care. Therefore, it's important they have information at point of care, and our part to play in that is ensuring that we participate in that digital ecosystem at an ICS level. We also understand each other's key priorities and how we continue to work together and always maintain a professional relationship with each other.